It's great to be here at ASCO 2017. We saw some updates on regimens that look very promising with low-grade lymphomas and with CLL. This meeting focused on both new combinations as well as some long-term follow-up of several ongoing or several completed trials. Two of the studies which I think were very interesting to see follow-up of were the BRIGHT study. That was a study looking at Bendamustine versus R-CHOP or R-CVP, as well as the STiL study, and that was another randomized study looking at Bendamustine Rituximab versus R-CHOP. Both of these studies were exploring Bendamustine Rituximab in untreated low-grade lymphoma patients and patients with Mantle cell lymphoma. So now with long follow-up, and these studies are both reporting follow-up around 7 to 10 years, we saw that the overall survival was not significantly different between Bendamustine Rituximab and R-CHOP arms. Now, what does that mean? In both of these studies, there did appear to be a benefit, albeit minor in one and probably a little bit stronger in the STiL study, in progression-free survival with Bendamustine Rituximab compared to R-CHOP. Now that didn't translate into a prolonged overall survival. Now there's a lot of reasons for that. Many patients who received R-CHOP and progressed went on to receive Bendamustine and Rituximab in both studies. Many patients with relapsed follicular lymphoma will often respond to second and third and fourth line therapies. So overall survival sometimes is hard to see in a disease like low-grade lymphoma, where patients live a very long time and have different regimens which are active if they relapse. One thing that we saw in both of these arms, there didn't appear to be an excess death rate in either arm. There was a recent study which was presented at ASH, which looked at Bendamustine, well, it looked at ublituximab versus Rituximab with chemotherapy, and in that study there did appear to be slight excess mortality in the Bendamustine arm. So I think these two studies at least reaffirm that, at least in that experience, there didn't appear to be excess death rate in the Bendamustine arms compared to R-CHOP. We also saw follow-up of the Genuine study. This was a study looking at Ibrutinib versus Ibrutinib and ublituximab, which is anti-CD20, in patients that had high-risk CLL. And it was very clear that the overall response rate was significantly higher in the Ibrutinib plus ublituximab arm versus Ibrutinib alone. So I think in high-risk patients, it's very clear that adding ublituximab and potentially other monoclonal antibodies to Ibrutinib does have benefit. And finally, we saw some data with combination studies looking at some of the novel agents. There was a study looking at Ibrutinib and FCR and CLL. Very small study, early results, but looks very promising. We saw very high rates of MRD negative bone marrow when Ibrutinib is combined with FCR in patients that had mutated heavy chain. We also saw outcomes of a phase 2 study looking at venetoclax plus Ibrutinib in Mantle cell lymphoma that is being presented by Con Tam from Australia, and that also looks very, very interesting. Response rates of around 80% with complete remission rates over 60% in relapsed Mantle cell lymphoma. So very interesting, and I think we'll hopefully see further follow-up with many of these studies at the next ASH and ASCO.